Hello. Welcome to Facebook Live number 15. If you're joining me live, thank you for doing so. And if you're watching the replay, type replay in the comments. I've been going live almost every day talking about different clinical sleep tips for physicians, therapists, and other health practitioners who are working with patients who ever struggle with sleep issues. So that's probably most of us, right? Because all of our patients sleep and many of our patients struggle with sleep issues. Today's question is from Dr. Vanessa Velez. Thank you, Dr. Vanessa. She's an outpatient psychiatrist here in the San Francisco Bay Area. She practices through an integrative psychiatry framework. So she attended my sleep supplements masterclass yesterday. And she had a question about Trazodone, which we didn't have time to answer on the masterclass itself. So I told her I'd jump on Facebook Live and talk about Trazodone a little bit. If we haven't met, I'm Dr. Nishi Bhopal. I'm a physician. I'm board certified in sleep medicine and psychiatry, and I practice through an integrative psychiatry lens as well. And I have a YouTube channel and an online course called the Clinical Sleep Kit, where I teach physicians and health practitioners all about sleep medicine, because most of us only get about 2 hours of sleep medicine training, but all of our patients sleep. The course is called the Clinical Sleep Kit, and doors are open now. So if you're interested in checking that out, I will put the link in the comments. And then if you want to join the Sleep Supplements Masterclass, I've got one more class coming up on February 21st, which is next Wednesday at 5 p.m. Pacific time. So I'll put that link in the comments as well if you want to join and learn about sleep supplements. Let me know in the comments where you're joining from, what your specialty is, if you have any specific challenges with sleep issues in your practice, or let me know your thoughts about Trazodone. I'd love to hear about that. So if you're using Trazodone with your patients, let me know in the comments. So I'm just going to do a really brief one on just my thoughts about Trazodone and some of the literature around it. We're not going to go deep into the pharmacology of it, but I'll just mention briefly it belongs to the class of serotonin antagonist and reuptake inhibitors, so SARIs. And at the lower doses that are generally used for sleep, so about 25 to 100 milligrams, it produces hypnotic effects because of blockage of the 5-HT2A, histamine H1, and alpha receptors. At higher doses, it has more antidepressant effects. So Trazodone is probably the most commonly used, or at least one of the most commonly used hypnotic agents for the outpatient management of insomnia. However, it is not FDA approved for sleep issues. There's 20 different drugs that are FDA approved for the management of insomnia, and Trazodone is not one of them. But why do we use it so frequently? So there was a study in the Journal of Clinical Medicine in 2023. This was authored by some really prominent sleep specialists. I'll put the link in the comments too if you want to check that out, like Dr. Rafael Palayo, Suzanne Burtish, John Winkelman, Phyllis C., like all the big names in sleep medicine. And so they were looking at this question of why is Trazodone so commonly used in outpatient practice, but it's not an FDA-approved medication. And in fact, the AASM, the American Academy of Sleep Medicine, does not recommend Trazodone for use in insomnia. But I use it with my patients who have insomnia, and I know lots of clinicians who do. And it's funny because I was talking to my sleep program director a few months ago. We still, even though I did my sleep fellowship like 10 years ago, we still keep in touch. And we had a call a few months ago, and he asked me, like, what's with all the psychiatrists prescribing Trazodone? Like, why are they all doing that? I'm like, well, there are reasons for that. And, I think that a lot of us use it because it is not habit forming, or at least it has a low risk for habit formation and addiction compared to some of the other FDA approved medications like the non-benzodiazepine hypnotics. So this study that I was talking about from 2023, they mentioned that their clinical guidelines do not recommend the use of Trazodone for treating insomnia. And they looked at a panel of 7 sleep specialists, and then they did a survey in outpatient communities, like in the field with psychiatrists and other outpatient doctors. And there was a clear discrepancy between the evidence base as interpreted by experts and in actual clinical practice. So you know, there is some data on trazodone for sleep. Actually, most of the data on trazodone is for its antidepressant effects. That's traditionally how it was used, but now many of us just use it for sleep in low doses. I don't know a lot of docs who are using the higher doses of trazodone for depression. Um, there are some studies showing that it can be really helpful in certain populations. There was a study in hospitalized patients showing that patients on trazodone were at a lower risk of falls versus patients who were on zolpidem or Ambien. There was another study from 2017, kind of a survey looking at or I think it was a meta-analysis of different studies on trazodone, and they found that it's relatively safe for a variety of different populations, including elderly populations. It's not used in pediatrics. There aren't really any studies on that, but for patients with depression, patients without depression, there's a lot of literature on that too. So I'll put that study in the comments too if you want to take a look at it. But like I said, I'm not going to go into all the details of all these different studies, but it's one of these things where there isn't a ton of data on trazodone. There's some, like the study that I just mentioned, but it's not sort of clinically sanctioned and it's not FDA approved, so it's considered off-label. So if you use trazodone, let me know in the comments. But here's how I think about it. So with any sleep aid that I'm using, including things like trazodone, I'm thinking about it in terms of short-term support for that patient's sleep issues. Now, I believe some of the studies that used trazodone only looked at it for 3 months. I'm not sure if there's any studies looking at it for beyond 3 months. If you know if there are studies looking at it for longer term, let me know. I'd love to take a look at that. But I usually use it for short-term support. And whenever I'm prescribing a sleep aid to a patient, before we even start the medication, I talk to them about a plan of how they're going to get off that medication. So before we even start, we're already talking about the plan to get off the medication, whether it's a tapering plan or we're looking at expectations as to how long they can expect to use it, especially if they're using it daily versus as a PRN. But even as a PRN, we talk about expectations around how often should you be taking it, how many times a week, when is it kind of too much. So we talk about all of those things. Now for trazodone, sometimes it is helpful for them to take it every night, maybe for a week or for a certain period of time for short-term support. And I do tell patients that we're not just going to rely on a medication. This morning we had the sleep supplements masterclass, and so we talked about sleep supplements are not the only thing that we're going to do. They're used as an adjunct or as support for a holistic treatment plan. So if the patient's struggling with insomnia, I teach pretty much every patient CBTI principles, and you don't need to go and do a whole CBTI training. If you do, that's amazing because we need more CBTI practitioners, cognitive behavioral therapy for insomnia. But I teach every patient how to implement sleep restriction or sleep compression. This is something that I teach you guys how to do in the Clinical Sleep Kit program. So if you want to learn how to do that, there's a whole tutorial in there. You can teach your patients how to do it, and then they can do it on their own. And then we work a lot on sleep promoting behaviors. We work a lot on reframing negative thoughts and other things that might be going on with that patient. And as always, we want to address underlying causes. So we want to make sure there isn't obstructive sleep apnea, that we're not just assuming that this is insomnia. So we want to make sure there's no OSA or restless leg syndrome or periodic limb movement disorder, or that there's uncontrolled anxiety or uncontrolled depression that might be comorbid, or that making sure there's no medical issues like thyroid issues or other things that could be going on, or uncontrolled hypertension, things like this. And then I look a lot at nutrition. The timing of the patient's meals, are there any nutritional deficiencies or insufficiencies, particularly vitamins D and B12 or iron deficiencies, which are implicated in poor quality sleep. So there's a whole kind of protocol that I go through with doing this kind of assessment, but trazodone can be a useful short-term adjunct as you're working on these other things. And so again, if you use trazodone with your patients, let me know in the comments and how you use it. I'd love to know how you're thinking about it. But how I think about it is that this is a support we can use. We can use it PRN, or we might use it continuously for a duration of time while we work on these other factors. So hopefully that was helpful. If you're interested in joining the Sleep Supplements Masterclass, we've got one more class on February 21st, which is next Wednesday at 5 p.m. Pacific time. And then the Clinical Sleep Kit is open for registration until February 23rd, which is next Friday. I'm happy to answer any questions you have about that. Happy Valentine's Day. Have a great evening. And then I will see you again tomorrow on Facebook Live. Bye for now.